Hi, I'm Dr. Fiella and welcome to my website and welcome to the fibromyalgia page. I wanted to take a couple of minutes just as an introduction to myself, my office, my techniques, and the condition of fibromyalgia. If you've come to the website, you may have fibromyalgia, you may have a loved one with fibromyalgia, you may be looking for answers, you either have it or you know someone who does. One quick thing. If you are not the person who has fibromyalgia and you're watching this and you get the idea that this would be a good thing if you went to see this doctor, to whoever it is that you know with fibromyalgia, enlist their cooperation first. Don't spring it on someone as a surprise. Hi, I made an appointment with another doctor for you, etc. That generally doesn't go over well. So when you have a loved one with fibromyalgia, enlist their cooperation first. That's always a really big help. And that's a main thing, okay? I'll get more to that later. But I wanted to take a couple of minutes again to go through what it is that I do, what might set me apart from other practitioners in the field that are treating things like fibromyalgia or treating, chiropractors that treat spines, whatever it is. So you have fibromyalgia, you know someone who does, and if you do have the fibromyalgia, I don't have to go through it with you, you know all about it, I'm sure. People who have fibromyalgia are probably some of the more educated people that I see. Actually, they know a lot about their condition. They know pretty much, they're up to date with what's going on, which is well done. That you're informed and you know all about what's happening with you. Fibromyalgia, just let's do a quick recap. You've got chronic pain, you've got pain all over, you've got fatigue, you have sleep disturbances, you have mental disturbances as far as clarity, etc., that fibro fog, etc. Okay, that's fine. So maybe you've tried treatments, you've been to the doctors, you've been put on Lyrica or whatever the medications are, and maybe they're not working for you. And that's something that I see a lot of, quite frankly, is that what people have tried is not working for them. I've been in practice a little over 20 years, almost 25 years now, and I remember very, very vividly a woman back in the late 80s who came to see me with chronic pain, fairly youngish woman, chronic pain all over the body, what we would now diagnose with fibromyalgia, and she came in and got wonderful results, and I wasn't doing neurology the way I'm doing now, and I wasn't doing the nutrition the way I'm doing now, and I was still getting very good results with her. One day she came in with a gentleman and introduced me to him and went about my treatment. Next visit she came in and I said, well, who was that with you? And she said, well, that was my husband. I knew that. But I said, so what does your husband do for a living? He says, well, he's the director of pain management at blank hospital. I won't reveal where, but it was very interesting. I was not practicing in New Jersey at the time. I was in New York. So I've been getting results for years with chronic pain and with people who have what we would now call fibromyalgia. At this point, though, in my career, my tools to work with people is quite grown, and I feel quite formidable. I am now working in the field of chiropractic neurology or functional neurology, and the fields of functional nutrition. So I'm working with the metabolic system, the body's chemical system, as well as the body's nervous system. And these are the two main control centers and two main control areas of a body. When they're not working in harmony, when part of the nervous system is overworking, for instance, sleep disturbances. A person with fibro is typically up all night and then exhausted by 3 in the morning. They have a very disturbed sleep cycle. What happens is both part of the nervous system and part of the glandular controls of the body go out of function, out of sequence, and they get literally reversed. This leads to being up at 3 a.m., being crashed out at 3 p.m. All right, just the opposite. So what do you do about it? Well, my approach is this. I take a really good history. There are many forms you'll have to fill out to come into my office. You'll see them linked up on the page here. There's a page for those forms, which should be filled out completely before you come into the office. I do a very thorough consultation history. You'll want to see what's going on with you, all the aspects of your life, and then we do an in-depth examination and evaluation for you. We will probably have to do blood work because with fibro I've never seen anything respond as well as when we do the neurology with the nutrition. So there will be blood work, etc., and supplementation, and more than likely diet modification the person's going to have to go on to. So you can see more of those on different pages of the website, the page What is Functional Neurology and the What is Clinical Nutrition page also, so you can read more about those before you come in. So if you do have questions, please feel free to call or send me an email. One thing I will say is this. I don't accept every patient who walks in or who is interested in my treatment. I will tell you that. I do have some strict criteria for accepting cases, particularly fibromyalgia cases. And I will tell you right off the bat, the number one criteria is you're going to have to want to do something about it. Okay? A person can have an attitude where they're going to say, well, some doctor is going to do something for me, and you know what, that's really not the attitude that's going to get a result, particularly with my methods, okay? We're not using drugs, we're not using medications, and it is up to you to want to do something and then act on that and then actually get involved in your health. And if you are already, that's great. You know, that's half the battle right there, and I'm probably going to be really glad to work with you. If you're not at that point, don't worry, all is not lost. It is actually up to you. Take some time, think about it. What do you want to do? Where do you see yourself in a couple of years? Having chronic pain, having this fatigue. And you're going to have to make up your mind. So when you've made up your mind, that's when I want you to reach out, okay? And just say, hey doc, I saw your video, I've been to your website. You know what? I've made up my mind. And at that point, we can march forward, because now you're more than likely to get a good result when we do this treatment. Otherwise, someone can do almost anything for you and it's just not going to work, all right? So again, lots of luck to you. I'm glad you watched my video. Sorry if I'm kind of wordy. I'm not a professional speaker by any stretch of any imagination, but I just wanted to get my message across to you about what I do. Feel free to explore the rest of the website, take a look, contact me with any questions, and thank you for watching. I do hope you got something out of this video. Thank you.